Welcome to Medicine Official. This is Dr. Bison EM. Today we're doing a trial test in histology, and I hope this will help in your upcoming test. What is this slide showing? So this slide is showing a multipolar neuron. So this is a multipolar neuron. Now, why is this a multipolar neuron? Because it has multiple processes. So because it has multiple cytoplasmic or cell processes. It has multiple cell processes. You can see it has this process here, 1, this process here, 2, this process here, 3, 4, 5, 6, 7. All the processes except 7 are dendrites. So these here are dendrites. The part that is labeled A here is an axonal process. An axonal process. We simply refer to it as an axon. All right. So that is slide 1. Let's move on. Slide 2. What is this slide showing? This is a motor end plate. Motor end plate. Why do we say that this is a motor end plate? Because of multiple axonal processes going to different muscle fibers. Because of different axonal processes or nerve fibers. Because of different nerve fibers going to different muscle fibers. So you can see this. This is the nerve coming here, and then it gives off a nerve fiber, goes there. The nerve fiber goes there, goes there, goes there, and it goes there. So you can see one nerve terminating at different muscles. This is a motor end plate. What is this slide showing? This slide is showing an autonomic ganglion. So this is an autonomic ganglion. Autonomic ganglion. Why do you say so? Number 1, the cells are multipolar. So cells are multipolar. Number 2, the satellite cells are fewer than in sensory ganglion. So satellite cells are fewer than in sensory ganglion. And the fibers are mostly unmyelinated. So fibers are non-myelinated. So this is how an autonomic ganglion looks like. This is how an autonomic ganglion looks like. Let's move on. What is this slide? This slide is showing a sciatic nerve. So this is a sciatic nerve. You can see the layers in this sciatic nerve. Okay. You can see the layers. So it has these layers here. Okay. So you've seen these are fascicles. These are covered by connective tissue. that is called perineurium. Perineurium. And then the nerves are covered by an entire connective tissue, like this. That is called an epineurium. And then each axon is covered by its own connective tissue that is called an endoneurium. So when you see a slide like this is a sciatic nerve. That is a sciatic nerve. Let's move. What is this slide showing? This is a sebaceous gland. Sebaceous gland. Why do we say so? We've got clustered cells, clustered pale cells. And then prominent nucleoli. Prominent nuclei. What is this slide showing? So this slide is showing this is the colon. And in the colon you've got an autonomic nerve ganglia. So this one here. So this is an autonomic nerve ganglia. Okay. Autonomic nerve ganglia. Nerve ganglia. It's a collection of cell bodies. All right, so you can see this is a cell body here, cell body, cell body. So this is a colon with an autonomic nerve ganglia. So why do you say so? It has an autonomic nerve ganglia. Autonomic nerve ganglia. Surrounded by smooth muscles, inner smooth muscles, and outer longitudinal muscles. So these are the smooth muscles here, and then these are the longitudinal muscles. Surrounded by smooth muscles, and longitudinal muscles. Longitudinal muscles. All right, what is this slide showing? So this slide here is showing the sensory ganglion. So this is a sensory ganglion. Why do you say so? This is a cell, the ganglion, and then it has this black substance here. So it has nissule substance. Nissule substance is simply a rough endoplasmic reticulum in the cytoplasm. There is also presence of satellite cells. Presence of satellite cells. And it has these nerve fibers here. So it has nerve fibers that are myelinated. All right, what is this slide showing? So this slide is showing this is the skin. This is the scalp, okay? This is the scalp, skin of the scalp. What features are showing? I can see this is a hair follicle here. Okay, so there you've got a hair follicle. And then you've got this as sebaceous glands. So you've got sebaceous glands. You can also see this keratin here on top. So you've got keratin there. And then you've got a stratified squamous epithelia. Stratified squamous epithelia. So here you've got a keratinized stratified squamous epithelia. All right. Name 3 regions in the body where you find the squamo-columnar junction. So this is a region where squamous epithelia will change into columnar epithelia. Number 1, you've got the esophageal. So esophageal gastrojunction, gastroesophageal junction. When you're transitioning from the esophagus to the stomach, you've got the anorectal junction. So the anorectal rectal junction, when you're transitioning from the anal canal into the rectum. And then you've got the vaginal cervical junction, or cervical vaginal junction. So vaginal cervical junction, when you're transitioning from the vagina, you're going to the cervix. All right. What is this slide showing? This slide is showing the liver. Why? Because you've got hepatocytes here. So those are hepatocytes. What is the structure labeled A? That is the central vein. What is the slide showing? This slide is a slide showing the developing tooth. So this is the developing tooth. What is this type of ossification? You can see that the tooth, this tooth here, is developing from these membranes here, which this is mesenchymal embryonic connective tissue. So this is intramembranous ossification. Intramembranous ossification. And then the part labeled D, that is just embryonic connective tissue. Embryonic connective tissue. You can say mesenchymal connective tissue if you want. What is this slide showing here? This is the sublingual gland. Sublingual gland. Okay, what are the features showing? You've got the white part here. So the white part there is the mucus acini. Mucus acini. And then the purple part is the serous acini. And then this part here is an interlobular septum. Interlobular septum. The interlobular septum is made up of dense irregular connective tissue. Dense irregular connective tissue. What is this slide? We saw a similar slide. So this is the liver. We've already said this is the liver. Why do you say so? It has number one, it has the central vein. It has the central vein. It has hepatocytes that are lined up in lines. And then it has sinusoids. These are called sinusoids here. Sinusoids. Between the rows of hepatocytes. So hepatocytes in rows. And between the rows of hepatocytes, this is the row of hepatocytes. The rows of hepatocytes, which will come and drain into the central vein, they are sinusoids. The stain that was used here was periodic acid skiff. Periodic acid skiff. It is denoted as PAS. All right, let's continue. What is shown in the slide? So you can see that these cells, the nucleus, are different levels, but all the cells are touching the basement membrane. All the cells are touching the basement membrane. So this is pseudo-stratified. And you can see that you've got this projection here, which is cilia. So pseudo-stratified ciliated columnar epithelium. Ciliated columnar epithelium. Where is this found? It's found mostly in the respiratory tract. So it's found in the trachea. You can also find it a similar epithelia in the epididymis, but the epididymis doesn't have cilia, it has stereocilia. What type of epithelia is this? This is transitional epithelium. So transitional epithelia. What are the types of cells? The apical part has got umbrella cells. Umbrella cells. So these ones here are the umbrella cells, UM cells. And then the middle part has got polyhedral cells, meaning that they have different shapes. Okay? Polyhedral cells, they can be columnar cells. The basal part has got cuboidal cells, simple cuboidal cells. So the basal part, this part here, that's cuboidal. And then the middle part has got polyhedral cells. So know the types of cells that are found in transitional epithelium. What is this slide showing? You can see this slide is showing muscle that is branched. Okay, so the muscle here is branched. You can see that. Okay, and between the branched muscle, you can see there are intercalated discs. So this is cardiac muscle. Cardiac muscle. Why do you say so? It is branched, number one. Number two, it has intercalated discs. What do you find in intercalated discs? You find desmosomes, which are tight junctions. It also has single nucleus. So this is the nucleus here. So it is mononucleated. So cardiac muscle also has gap junctions. These gap junctions are capable of conducting electrical impulses between two muscles. So what will happen is cardiac muscle will work as a unit. It will contract at the same time and it will relax at the same time. Cardiac muscle works as a single unit, and this is known as a syncytium because it works at once. What is this slide showing? This is a fetal finger. Why do you say this is a fetal finger? You can see this is bone here. This is bone here. That is compact bone. And then this is spongy bone. So that is spongy bone or trabecular bone. This part here labeled E, that's where the bone is growing from. So that is hyaline cartilage. Hyaline cartilage. The type of ossification where bone grows from cartilage is what we call endochondral ossification. What is this slide showing here? You can see these structures here, this structure here, these structures here. Those are renal corpuscles, and they are most prominent in the renal cortex. So this slide is showing the renal cortex. What are the parts labeled Y? Part labeled Y is the Bowman's space. So the Bowman's space. The part labeled N is the proximal convoluted tubule, which is PCT. The part labeled A is the glomerulus. The glomerulus. Okay, what condition is shown here? This is spinal bifida. Spinal bifida. Okay, so now what causes this condition? Incomplete closure. Incomplete closure. So incomplete closure or lack of closure of caudoneural pore. What are the types of these conditions? You've got spinal bifida or cauda. You've got myelomeningocele, which is the most common. Meningocele. And then you've got meningocele. Meningocele. All right, let's move on. What condition is this? This is anencephaly. What causes this? Failure of failure of cranial neuropore closure. So the cranial neuropore doesn't close, so you have an encephaly. What is this slide showing? This is dense regular connective tissue. Dense regular connective tissue. Where is this type of tissue found? It is found in the tendons, it's found in the ligaments, it's found in the corneal stroma, the stroma of the cornea, and it is also found in the aponeuroses. So aponeurosis. Okay, now let's look at this slide. What are we seeing here? We can see glands. These are glands. And inside of these glands, we can see some materials that the glands have secreted. So this is the uterus, showing secreting glands. Secreting glands. What is this slide showing? This is bone tissue. So what are the parts labeled A? The parts labeled A, that is compact bone. Compact bone. The part labeled B is what we call trabecular bone. Remember, there are two types of bone. Histology, gross classification of bone, we've got compact bone and trabecular bone. Histological classification of bone, we've got woven bone and lamellar bone. C is simply the bone marrow. So bone marrow. Okay. Identify the condition. Look at this baby. The baby was born with this growth here. This growth is what we call a sacrococcygeal teratoma. Okay. I hope this is the correct spelling. Sacrococcygeal teratoma. What is this? This is caused by, what is this caused by? It is caused by persistent primitive streak. So if the primitive streak doesn't degenerate by the 4th week, you're going to develop, the baby will be born with a sacrococcygeal teratoma. Name 2 things that can be found here. You can find teeth, you can find bone. In this growth, you can find hair. All right. What is this slide showing? This slide is showing loose or areolar connective tissue. Loose or areolar connective tissue. Where is it located in the body? You can find it in the papillary dermis of the skin. So the papillary dermis of the skin. Or you can find it in the lamina propria in the GI tract. The part labeled A there is a big cell and it has ingested material, so that is a macrophage. That is a macrophage. Let's move on. What is the slide showing? This slide is elastic cartilage. Where is it located in the body? So you can find it in the pinna of the ear. You can find it also in the epiglottis. The part labeled B is the chondrocyte in a lacuna. So that is a chondrocyte in a space that is called a lacuna. C is a connective tissue that is surrounding the cartilage. So this is a perichondrium. Identify the tissue. This is teased smooth muscle. Teased smooth muscle. Give one location. Can be found in the uterus. Smooth muscle can be found in the uterus. It can be found in all the viscera in the body, in the stomach, in the blood vessel. Okay, blood vessels. Move. What condition is this? See, this baby is born with one leg. That is what we call Sirenomelia. Sirenomelia. Or caudodysgenesis. You can say caudodysgenesis. What causes this condition? Insufficient mesoderm in the caudal region. So insufficient mesoderm in the caudal region. What day of development is this? This is day 11 to 12. So this is day 11 to 12. When you look at this, there's a development of the extra embryonic mesoderm that has developed chorionic cavities, which happens at day 11 to 12. Identify the slide. This is the ileum. D are clips of Libacune. Clips of Libacune. And then E is what we call the plica seculare. Plica seculare. Let's move on. Identify slide A and B. A is the umbilical artery. So this is the umbilical cord. Umbilical artery. And the connective tissue that is surrounding the umbilical artery, which is B, is called Wharton's jelly. Wharton's jelly is also known as mucoid connective tissue. Mucoid connective tissue can be found, number one, in the umbilical cord. Number two, can be found in the developing tooth. Okay. In what week of development does this occur? So you can see cells are migrating from the epiblast and forming the trilaminar layer. This occurs in week 3. And this process is called gastrulation. All right. Now, identify this slide. This slide shows a lot of blood cells. So this, you can say, blood smear. Blood smear, or you can say bone marrow smear, depending on the cells that are found here. Okay. So this is a blood smear, bone marrow smear. Name the shown parts. So A, these are red blood cells. C is a lymphocyte. E is a neutrophil. F is a monocyte because it has a kidney-shaped nucleus. B is an eosinophil because it has red granules in its cytoplasm. D is a basophil because it has blue granules in its cytoplasm. This structure here, the cell here, is a platelet. So this is a platelet. Okay. So this is the blood smear. There are two types of blood smear. You can have a peripheral blood smear or you can have a bone marrow smear. Identify this slide. This slide here is a tongue. It shows the tongue. The type of muscle that makes its core is skeletal muscle. The part labeled J is a fungiform papillae. Fungiform papillae. The part labeled H is a filiform papillae. So you have to know the types of papillae that are found in the tongue or on the tongue. All right. Identify the slide. So this slide has got stratified non-keratinized squamous epithelia, and its submucosa has got no glands, so this is the vagina. Number 1, it has stratified squamous non-keratinized epithelia. Number 2, the submucosa has no glands. Identify these slides. This slide is thick skin. How do you know? Number 1, it has a large layer of keratin there. Okay, so this part here, the stratum corneum, is big compared to the rest of the epidermis. Okay, so large corneum layer. Okay, that is the end. All the best in your lessons, all the best in your test. And as always, let's medicine together. See you in the next video.